Yeah, so there's a lot of questions. A lot of people don't like daylight savings time, and a lot of people think of daylight savings time as only the switches in the spring and fall, and that's not actually what it is. It's the time period where we shift the clocks later between the spring until the fall, and there's actually long-term consequences in that whole time. So a lot of the studies that we have really look at what can happen in the week after the spring and fall. So we do see a lot of bad consequences. We recently had a paper looking at headache frequency going up in that period, but lots of past studies on strokes, depression, heart attacks, car crashes, outcomes of students doing schoolwork. We see those outcomes, but a lot of the more long-term data that shows there is this sort of circadian disruption and potential loss of sleep, especially when we mix later sunrises and sunsets with our current usual early start times of work and school times here in the US, that really can increase risks of obesity, of cancer. We have some new evidence, a study recently about stroke risk. We have data on car crashes going up. So a lot of people think if it's light later, it'll be safer for driving. We actually see the opposite. We see about a 20% increased risk of fatal car crashes in places where the sun is setting an hour later and more misaligned with the sun being overhead at noon. So that has really framed the argument of which time should we keep. So if we want to end the current switches, it's really important that we don't end it with permanent daylight savings time, which can increase these overall risks, but go with the more sun-aligned, naturally aligned, sleep-promoting time of permanent standard time.